says this vaccine was criticized for being developed in association with China as if this were a sin. So how do you make of his comment? And have Chinese vaccines faced in general some kind of a discrimination when being promoted around the world? What is your company's experience?
I think it would. I will not be judging for the comments from others, but I think as a manufacturer, a vaccine manufacturer, it is our mission to develop and supply vaccines to help people, to protect people. It doesn't matter whether it is from China or from US or from UK. We only need to focus on whether we have a safe and effective vaccine, which could be deployed easily and can be provided good accessibility to the world to help people everywhere to going back to normal.
China has already administered nearly 23 million doses of COVID-19 vaccines as the country's campaign intensified to vaccinate 50 million people before next month's Lunar New Year holiday.
Based on the study in, I think, over 2,000 elderly people above 60 years old, and we have seen a very good safety data as well. And from our phase 1 and phase 2, we see the seroconversion rate, meaning the level the antibody arise after getting the vaccine, is comparable to a healthy adult aged from 18 to 59 years old, which we think is a very encouraging results. Elderly people are recommended, like in Brazil and Turkey, they already started to vaccinating people aged 80 or even 90 years old. And based on our study that we provided, the vaccine, inactivated vaccine is very safe to elderlies, and we have seen that antibodies can be induced after elderly people receive the vaccine. So we think because most of the severe cases and hospitalized cases or even fatal cases were coming from this vulnerable group, and we do recommend that they need to be protected as a high priority.
How about
근데 이 과학적인 사실에 의해서 영향을 받아야 되는데 정치적으로 이게 이용되고 있단 말이에요. 너무나 불편합니다, 저는요.
감기는 그 감기 바이러스가 항상 우리 몸속에 있다라는 생각을 하셔야 돼요. 독감 바이러스는 우리 몸에 있지 않습니다. 그거는 누군가가 예컨대 뭐 홍콩을 갔다 온 분이 홍콩에서 유행하는 홍콩 독감에 감염돼서 즉 인플루엔자 바이러스라는 거죠. 인플루엔자 바이러스에 감염이 돼서 이제 들어오는 거예요.
Kind of data that you don't want to just say, well, I think it should work, and then not prove it. There's a long line of vaccines that are still in development. Some of them may actually be better than the vaccines we have now. The best way to be able to test them and to test them quickly will be if we have this correlative protection.
Yeah.
Does the vaccine protect you, the vaccinated person, against COVID-19 disease? It doesn't tell us whether it's preventing COVID-19 infection, and it's not telling us that a person who's vaccinated will not transmit the virus to other people. So if you're vaccinated and you happen to be exposed, you may actually develop an infection that doesn't have any symptoms. And it's those people who can, again, spread the virus, which is why health authorities in China and elsewhere are saying, even after you've been vaccinated, you still have to wear a mask. The widespread vaccination of individuals and more rigorous following of the requirements for social distancing and masks and avoiding crowds will help us to control the virus itself, will reduce the number of mutations. That's one aspect. And then as the new mutations come out, we really need a worldwide system that is open, transparent, and shares information about the new mutants very quickly so that the companies can rapidly test their vaccines against these new mutants in a test tube.
But towards a strategy of peace.
But every crisis has both its dangers and its opportunities.